Hey, it's Dr. Menges again, Healthbridge Chiropractic and Rehabilitation here in beautiful Bel Air, Maryland. And I'm here with Joan Finney, who's going to talk a little bit about her experience in her office. So with no further ado, here she is. Joan. So talk a little bit about how you got to me.
Actually, I got to you because I was referred by a friend. I've been having trouble with leg pain and foot pain for some time, and it's getting really uncomfortable, and I was concerned. And someone told me about you and said that it would be to my advantage to come over here, that it felt I would really profit by doing this. So I came here to Healthbridge, and if I could think of Dr.
Menges?
Menges. I'm sorry about that.
It doesn't matter.
Dr. Menges, you were referred, and I came over, and I wasn't really sure because I hadn't been myself to a chiropractor. Well, the first day I felt a lot more comfortable after having seen you and also met the staff and everyone. And I started coming for therapy, and to be honest, I was a lot more relieved than I thought I would be. And I feel better, and I want to continue coming here because I think that basically not only does your staff do the therapy and everything, but they're very, very concerned about their contact and the manner in which they react with the patients. And I think that's the #1 need in any profession. I really feel better since I started here, and I'm going to continue until I'm as well as I can be. And I could say 100 more things, but I don't have time.
First of all, I think it's hilarious that you got camera shy and forgot my name.
Yeah.
Now,
I've been on the camera enough, but I can't. Did you know I was on Channel 24?
I did not.
In TV?
I did not.
On the adverts.
Cool.
And that they did by a sneak.
Oh,
at the
really?
Hospital, because they knew I didn't like to, you know.
Oh, they snuck it in on you.
No, they actually came and.
Well, they didn't tell you they were coming.
They didn't tell me who they were.
Oh.
They just told me they were there from Bon Secure, and they were at Bon Secure Hospital. So I thought they were going to take the pictures there for whatever, for, you know, the staff.
Mm-hmm.
And it turned out that within weeks, I happened to turn Channel 24 on, and there I was, taking care of a patient.
Well, and now you're going to be not all over Baltimore, you're going to be all over the world, which is kind of fun too.
Boy, did I make it.
Woohoo!
Now I feel better.
Now your case is kind of interesting in that, and one of the things that I talk to people about is, you know, with some people's conditions, you know, they come in and we fix everything and they're fine and we're done. And your situation is a little bit different in that we're helping you to coordinate care with the things that we can't fix as well, which is, I think, is important. And I don't know that happens everywhere.
Well, it didn't happen. Actually, in all honesty, I'm under the care of a medical doctor for a good bit of time, and I certainly have verbalized to him what has happened with my foot and everything, but he seems to think that, you know, arthritis pill or something was going to help it.
Mm-hmm.
And this is now a couple of years, and I am in a lot more severe pain and limited until I came here.
Mm-hmm.
Now I feel positive, and I feel that I will get there. And if I get negative, Dr. Menges will make sure that I change.
I force you to be happy.
And that is really the truth.
That's huge, though. That's a very important aspect of getting better is being in the right mindset to be able to receive getting better. Not to get, you know, waxed too esoteric or get too far out there, but
And that's true, and I think that that part of what you just said has to do with the total care. and the outcome of it. It's not just physical care. You need to have mental understanding of your situation and be positive about it. And if a person isn't like that and the caregiver is, it can make a big difference. And I think that's a number one thing. And it is here at your facility.
Thank you.
I'm glad for that.
It's kind of like being able to see the light at the end of the tunnel. You may know that there's a long way to go through the tunnel, but if you can see that little dot and just know what's possible, what could happen,
you're right.
It makes everything better.
And I actually have gone out of here from my therapy and told a lot of the nurses at the hospital where I'm retired, but I do go back there 1 or 2 days a week to take care of things in my department. And I've told a lot of them about this facility and you.
Thank you.
And they said, finally, you got some help, and we knew it would be when they started paying attention to the need.
Yeah.
And I appreciate that very much.
Sure.
And when I'm totally better, I want another picture taken.
Okay. Fair enough. Fair enough. Anything else? I got to wrap this up. Anything else you want to add or tell everyone about us or about chiropractic in general or about the flowers you saw on the way here or anything at all?
I think he just said he wants some. I might do that. And actually, the one thing I can say about this place is I truthfully feel that I'm in good hands and that the outcome is going to be positive. And I want to thank every individual here because I haven't found one who was anything but what they should be in this type of a job or position. And I'm glad that I found this place.
Awesome.
And thank you, Doctor.
Oh, you're very welcome. It's entirely my pleasure. Well, with that, we're going to go ahead and wrap it up. This has been Dr. Menges, Healthbridge Chiropractic and Rehabilitation in Bel Air, Maryland. Thank you very much for hanging out. Go to drmenges.com. And as always, have a better day. You deserve it. See ya.